Hi, everyone. My name is Candace Grisham, and I am a fourth year medical student, fourth year MD PhD student at Vanderbilt University. I am currently the neurosurgery interest group leader for SNMA, which is a new position that we created specifically for neurosurgery. And I'm really excited because tonight I get to host Sowing Seeds program created by our National President Associate in collaboration with the Alumni and Multicultural Affairs National Committee and continued with our current national president, Nita. Throughout this year-long program, we will provide resources on how to succeed as a pre-med and medical student, and we'll touch on everything from financial literacy to preparing for board exams and more. So make sure you are a national member by visiting snma.org and signing up to stay in the know. Like I said, I'm the neurosurgery interest group leader this year, and I'm really excited to host tonight's Sowing Seeds, which is on neurosurgery and orthopedic surgery. And I feel like a lot of students end up kind of coming between these two specialties. And so it's great to have both of these specialties represented tonight and to learn more. Without further ado, I want to just go ahead and jump in and introduce our panelists. Tonight, we're going to start with introducing the neurosurgery panelists. Everyone will come up and kind of give a little bit of background on themselves. And so first, I'd like to introduce one of our neurosurgery attendings this evening, Dr. Annalise Rodriguez, who is a neurosurgeon scientist and an associate professor and director of neurosurgical oncology at the University of Arkansas for Medical Science. Welcome, Dr. Rodriguez.
Hi, everyone. Very nice to meet you. I did MD PhD program at Case Western, and then afterwards did my training at Wake Forest, and then fellowship at City of Hope, and ultimately decided to join the University of Arkansas for Medical Sciences.
Awesome. And I think you kind of touched on everything. Perfect. And I think that was it. You mentioned medical school. Perfect. All right. And so I'll just keep rolling through and introduce the next, our next panelist for this evening. So next we have Dr. Akinduro, who is a chief resident PGY7 at Mayo Clinic Jacksonville, who's also joining us this evening. Thanks for coming, Dr. Akinduro.
Yeah, absolutely. I'm happy to be here. So as you mentioned, Oluwaseun is my full first name, but I go by Olu Akinduro. So seventh year neurosurgery resident currently at Mayo Clinic in Florida. I finished medical school at Morehouse School of Medicine in Atlanta. And my current interests are spine oncology and complex spine. And I'll be doing a fellowship next year at Brown. And then I'll take an academic job. I have a couple of options, but haven't signed anything yet. But I also am interested in basic science research. And last year I spent a year in the lab and got something called an NREF grant to complete some work looking at a spine tumor. So if anyone is interested in science as well as surgery, feel free to reach out to me. Thank you.
Great. And then also, once I pull up all the neurosurgery panelists, I will ask a couple other questions and then switch over to the orthopedic surgeons, just so the audience knows. Next up, we have another resident, Dr. Sabrina Himanaka, who is a PGY5 neurosurgery resident at University of Pennsylvania Health System. Thanks for being here.
Hi, thanks so much for having me. Looks like we're being asked to hold off on giving our intro, so I'll wait till everybody is up here.
Oh, no, you're fine. Just go ahead and say like what your path to neurosurgery was. Like, where did you go to medical school?
Okay.
I know you also have your doctorate in philosophy, so if you want to talk about that a little bit too.
Sure. Yeah, so I went to undergrad at the University of Pittsburgh, medical school via the MD PhD program at UNC Chapel Hill. And I actually ended up doing my PhD in the NIH Oxford Cambridge Scholars Program. So I spent 1 year at the NIH and 3 years overseas at the University of Oxford in the UK, studying Parkinson's disease, and then came back, finished up my medical school at UNC before joining Penn for neurosurgery residency. And current interest is skull-based neurosurgery. So.
Awesome. And then finally, we have someone who's very close to the process, so can answer all your questions about applications. We have Dr. Sarpong, who is a PGY1 at Vanderbilt University Medical Center. And welcome, Kojo. Thank you so much for coming here.
Thank you for having me. Again, my name is Kojo. Just interesting fact, Kojo just means Monday born. So in Ghana, every male born on Monday is called Kojo. So I'm Kojo, went to undergrad at Emory, took 2 years off to do research at Mount Sinai, studying epilepsy, and then went to medical school at Georgetown, and now at PGY1 at Vanderbilt. I'm a baby in the field, so I actually do not have any interest. I'm just trying to explore all the different subspecialties within neurosurgery.
Awesome. And then now that I have all the neurosurgery people up, can each of you go through and say, how did you choose neurosurgery? And then did you have any mentors in the field?
I guess we'll just go in order. So for me, neurosurgery was a childhood dream. I think that's fairly common. So I saw something on TV and I thought, I was in about the 4th grade, and I thought, oh, that's really cool. I really want to do that. However, I went beyond that in some ways. Obviously, I was given Ben Carson books growing up. I think most neurosurgeons, especially if you're a Black child, you were given Ben Carson books. That's not uncommon to many of our stories. But then in middle school, one of my best friends, their dad was a neurosurgeon, and her mother told me that neurosurgery is terrible and I should not go into it. And I'll never have a family or see my family. So that was kind of interesting. I bet we'll talk about that in the future a little bit. And then going into medical school, I actually went early on in my first year, shadowed neurosurgery. And I definitely was convinced, yeah, this is for me. I was also very lucky to go to Case Western, where 2 of the first 4 Black women neurosurgeons were trained. So when I was a medical student, Dr. Deborah Blades was an attending. I thought that was really important because it's extremely rare to go to a medical school where you have a Black woman neurosurgeon on staff. Along with her, there were various other mentors, but I don't think she'll ever know how important that was to me.
Thank you. Dr. Akinduro.
Yeah, absolutely. So in terms of my path to neurosurgery, I don't have the amazing childhood dream kind of story. I mean, I always kind of liked the brain. So me, it was more so a fusion of things. Like I always liked the brain, and I always loved building things. Like I was the kid who the most exciting days were when my mom would bring home like a drawer, like a chest or something for me to build. And I just always liked building things, doing things with my hands. That was kind of my thing. I was an athlete, and I just, liked doing things physically. So when I kind of went into medicine, I knew I wanted to do something with my hands. I knew I wanted to, kind of the instant gratification. So, a friend told me to kind of think about neurosurgery because, like I said, I was interested in the brain. And I shadowed a neurosurgeon, and initially I was like, man, this is amazing. It was a pediatric neurosurgeon, and I saw a vault remodeling for craniosynostosis, which is essentially where they take the skull apart and put it back together in the most simplest terms. But I actually, after that, kind of got diverted from neurosurgery. So I was at Morehouse, and we didn't have a neurosurgery department, and everyone told me, don't even think about it. Like no one matches into neurosurgery. It's tough to get into, and the lifestyle it sucks. You're not going to see your family. So that kind of deterred me. And then no one had matched in neurosurgery at my med school in 7 years before that point. So I initially started to think about other specialties. I looked at ENT. I looked at plastics, mainly because the craniofacial component, because like I said, I liked that specific procedure. But some great advice that someone told me was to look up the top 3 most frequently performed surgeries by any specialty, any surgical specialty, and just see if you would be okay doing that for, essentially the rest of your life. So for ENT, it was like, ear, nose, throat related things. And I was like, no, that sucks. There's no way. So similar concept for plastics. I was like, no way. So I landed on neurosurgeon. I was like, man, I can do this for the rest of my life. So that was really the one thing that kind of steered me towards that. And in terms of mentors, like I said, we didn't have a neurosurgery department, so I didn't have any initially. So it really just took me sending out emails to people. I connected with some guys at Emory. Dr. Oyosiku was the first person I reached out to. He's a Nigerian, and he connected me with someone else who I ended up doing a lot of my research with. So for me, it took a lot of just sending out emails, reaching out to people, and thankfully it all worked out. But that's not an infrequent story to not really have access, but kind of figure it out. So I'm happy to, excited to talk more about that as this thing progresses. Thank you.
Great. And Dr. Himanaka?
Yeah, I would say my path to neurosurgery itself was a little bit roundabout as well. I spent a year between undergrad and starting med school doing research, which was at Mayo Clinic in Rochester, entirely focused on breast cancer, immunology, and tumor microenvironments, and saw myself initially going into oncology, actually. And it was through shadowing both at Mayo Clinic and at UNC, where I went to med school, in surgical oncology, medical oncology, hematology oncology, that I sort of realized that none of those were quite the right fit for me. So when we sort of were investigating different subspecialties in our first couple of years of medical school, I was really attracted to the neurosciences and found myself wanting to read and learn more outside of what we needed to know, and just sort of naturally curious and sort of wanted to investigate anything related to the brain. So I initially shadowed with neurology as a result of that interest, and also found it somewhat disheartening that there was this there's a lot that goes into sort of localizing the lesion, if you will, but then beyond that, I felt a little bit disheartened at what you can do once you found it sometimes. So then we had a neurosurgeon, Dr. Eldad Hadara, who would become my sort of longest standing mentor to date, who's just a phenomenal human being, phenomenal surgeon. And he gave us a talk early in my first year of med school where he was going over Parkinson's disease pathology, but then also the surgical management of it. And when he showed a video in class, I was like, is that something that I can come see live in the OR? And he was like, absolutely, anytime, come shadow. So I took him up on the offer, and the first case that I saw with him was a veteran who was, sort of this very stoic, very strong appearing person who you would never expect to have like psychosocial issues related to him just by looking. But he was really, really devastated by his Parkinson's disease. It had like ravaged his life. It had changed his like ability to socially interact with his friends of the same ages. And so he came in for the procedure and, seemed totally fine initially, but having his tremor stop during the case brought tears to his eyes. And it was such like a miraculous moment for everyone in the OR. That was when I realized this is what I want to go into. And Dr. Hadar has continued to be a significant mentor for me to this day. Started that first year of med school, but he's someone who I still talk to this day as things come up that I want his advice on.
Great. And then Dr. Sarpong?
Oh, yeah, thank you. So my path is quite different. I mean, I think many of you have read stories online on Medscape and stuff. So I, came into the United States, and I was just trying to figure out what I really want to do with my life. But normally, like things that got me into neurosurgery, one is personal. So we are 4 boys. I'm the last born in my family. The third born was born paralyzed. So since birth, he hasn't been able to walk in his entire life. So he uses crutches and wheelchair. So growing up, I was just very curious about, what pretty much caused this paralysis. And again, I did not even think about medicine because, there are so many things that I could worry about initially. So coming into the United States, started working in housekeeping for about 5 years in a hospital and seeing physicians. And that's when even medicine came into the picture. Fortunately for me, started at Emory, did neuroscience, got interested in the brain. And I was like, oh, this is cool. Did research in peripheral nerve injury. And I was like, oh, I think this is cool. Then took 2 years off to do research at Mount Sinai, also still studying epilepsy. Then started medical school at Georgetown. And I think what really took it for me, honestly, was when I started Georgetown. I sent a random LinkedIn message to a neurosurgeon scientist at the NIH, Dr. Ejayindum. Just randomly messaged him, did not know him from anywhere. Messaged him, was like, hey, my name is Kojo. I just started medical school at Georgetown, interested in neurosurgery, and would love to work with you. So it was that moment when he responded, got me a position in his lab at the NIH between my first and second year of medical school. And that is where it kind of like confirmed for me. So coming back to Georgetown, several mentors have played a critical role, including Dr. Endom and also Dr. Christopher Calhoun, who is at Georgetown. So he's a functional neurosurgeon, and he led me in on his case of the DBS surgery. And I saw it and I was like, wow, this is the coolest thing in the world I've ever seen in my entire world. So I was like, okay, this is exactly what I want to do. I think I want to, do neurosurgery. So again, my journey was rough, and that's how I ended up here and now at Vanderbilt. So I'm very happy to be here.
Awesome. Thank you all so much. So next, we're going to move into introducing the orthopedic surgeons. First, we will start with Dr. Oni, who is an assistant professor and director of orthopedics at Johns Hopkins Bayview. Welcome, Dr. Oni. Thank you for being here.
Hello, how are you? How's it going, everybody?
Great. Yeah. And could you just give us a little background?
And actually, I'm not the director of orthopedics anymore. I am now the fellowship director. So I guess it's a tomato. Doesn't really matter. But yes.
Awesome. And could you give us a little background on where you went to medical school, and then how did you choose orthopedic surgery, and then did you have any mentors in the field?
Fantastic. Yeah. So I went to medical school at Howard University in Washington, D.C. Did my residency at NYU Hospital for Joint Disease and my fellowship at Rush in Chicago. So all fantastic cities. And my first job out of fellowship was in Philly for about 3 years. And now I've been in practice at Hopkins for the past 7 years or so. So about 10 years in practice. I do mostly hips and knees. So I replace people's hips and knees. That has been mostly my focus for the past 10 years of practice. I think the other question you asked was about mentors, right?
Yes, mentors, and then why did you choose orthopedics?
Why choose orthopedics? Yeah, so I chose orthopedics really for a few reasons. One was I actually always thought I wanted to do cardiovascular surgery when I was in medical school, and I came into medical school thinking cardiovascular surgery. And in third year of medical school, I rotated through the cardiovascular surgery rotation, and I hated it. And so I already had my general surgery rotation set up for fourth year, and this was towards the end of third year. And I was freaking out because I knew I couldn't do this specialty. And so in my medical school at Howard, they randomly put you on some subspecialty rotations after doing your general surgery during your general surgery rotation. And one of my random ones was orthopedics. They just threw me on orthopedics right after my cardiovascular, section of the general surgery rotation. And I just fell in love. I fell in love with the surgeries. I fell in love with the surgeons. I fell in love with just the abilities to identify a problem and restore people's mobility, relieve their pain, and improve their quality of lives. And another thing is when I was on the cardiovascular rotation, a lot of people died. And I just didn't think that was the kind of practice I wanted to have. I didn't want to have a lot of family meetings talking about mortality and things of that nature. So, and the orthopedic rotation was just a lot happier, and it matched well with my my personalities. But something else happened around that time that made me choose orthopedics. I found out around the same time that my paternal grandmother in Nigeria had end-stage arthritis of both knees and was debilitated and couldn't really walk much. And I was asking my father, who was a general practitioner, like, hey, listen, why can't you just have somebody fix grandma? It was like, there's no one to do her total knee replacement. I was like, what? I couldn't believe it. So from that moment on, I was not just interested in orthopedics. I wanted to get into orthopedics to learn how to do total joint replacements, particularly total knee replacements. And the rest is history. Never turned back after that. But that actually ties in nicely with the next part of the question, which is who are the mentors, or what role did mentorship play? It played everything. I mean, mentors were super important to me because most people that went into orthopedics already kind of knew they wanted to, since I think first year of undergrad or something like that. So at least the people in my class, I seemed like they always knew they wanted to do orthopedics. And so they were prepping for it for a long time. And so to just all of a sudden switch in the last part of third year was pretty tough. It was mentors that I had to call in different institutions for me to get me last minute rotations. It was there were mentors that actually told me that, you know what, it's still okay. You can still do it, despite the fact that you're doing it last minute. There were mentors at the different rotations that I went to that decided that, you know what, despite that they just met me and they just only worked with me for only 1 month, decided to not just mentor and support me, but sponsor me. What I mean by that is that they actually decided to write amazing letters that would make it almost seem like they've known me all their lives, and that went a long way to helping to bolster my application and help me be successful in the process. So, and I mean, my mentors have helped me throughout my entire career, throughout residency, even going on to practice. I mean, I still spoke to one of my mentors today, who, like 7 years ago, when I was transitioning from my old job to my new job, spent over 2-3 hours on the phone with me, going over my contract. And that was very pivotal to helping me. So it's been incredible, the role of mentorship in my life, and I couldn't say thank you enough to all those mentors.
Awesome. Thank you so much. Next, we'll move on to Dr. Gauze, who is an assistant professor in the Department of Orthopedics at University of Missouri in University of Missouri, Kansas City. Welcome, Dr. Gauze. Thank you for coming.
Hey, thanks for having me. I was trying to decide if I was going to start talking with mute on like an old person, but I elected not to. I'm trying to be like y'all young people. You want to go ahead and say who I am and all that good stuff? Or?
Oh, yeah. So this is Dr. Gauze, everyone. Oh, no, you're fine. No, this is Dr. Gauze, everyone. He is an assistant professor at University of Missouri, Kansas City. And so can you just give us your background again with medical school? How do you choose orthopedic surgery, and then mentors in the field?
Sure. I'll be very, very brief.
Nathan, they actually introduced you before, but I guess you just needed that double introduction, brother.
That's me. You know me.
I'm messing with you, bro.
I love it. So, Nathan Gauze. Let's see. I went to medical school at the University of South Alabama down in Mobile. I'm originally from Ohio, but ended up down there because I enjoyed the Southeast at the time. I did my residency at the University of Cincinnati, where I'm originally from. And then I did a fellowship in foot and ankle at the University of Tennessee by way of the Campbell Clinic, which is kind of a big deal in orthopedics. If you're interested in ortho, you probably know the name. So I did a lower extremity residency there where I focused on the foot and ankle and learned all the pathology of the foot and ankle and became an expert at that. From there, I ended up going to the middle of nowhere, Iowa, and I practiced there for like 10 years and ended up segueing into more corporate medicine, where I was over the entire health system in terms of being the chief medical officer as well as chief medical information officer, and practice ortho as well at the same time. So I was able to kind of navigate both worlds. I then pivoted and moved 2 years ago to Kansas City, Missouri, and became faculty. This is kind of right in the middle of COVID. Became faculty at the University of Missouri out of Columbia, and have subsequently become an adjunct professor at the University of Missouri at Kansas City. And my whole goal with that, the whole move, was I wanted to make sure that I was giving back, and I wanted to make sure that I, as I commonly say, sojourner truth as many people that look like me into orthopedics and into medicine in general. And so I've made it my kind of mission moving forward to participate on medical school admissions committees for both colleges, as well as to be part of the orthopedic program and help make decisions about what residents we bring in, what medical students we bring in for residency and treat, or in train rather. So mentorship and orthopedics for me goes hand in hand. I had a mentor by the name of Dr. Thomas Shockley, who was the first Black resident coming out of Vanderbilt, who took me under his wing in undergrad. I was a sophomore in undergrad, and he took me under his wing. This was like the coolest man on the planet to me. And if he had been a cardiologist, if he had been a family medicine doc, I wouldn't be just like him. Well, he so happened to be an orthopedic surgeon who did subspecialty training in sports medicine. And I owe a significant debt to this man, because he always kept me on the right track. When I got to medical school, he helped keep me focused. It was tough kind of knowing what I wanted to do prior to getting in, because the field's so competitive and I just wasn't sure. And I had a lot of imposter syndrome that I dealt with, but he helped me get through that and then introduced me to other mentors like Dr. Alvin Crawford, who ended up training me in Cincinnati. So mentorship for me has been integral. And whenever I talk to medical students and high school students and college students, I'm always harping on the importance of mentorship. There's a lot of literature or progressing literature in orthopedics now that just discusses the importance of mentorship. I take it one step further. It's important to have mentors that look like this if we're going to continue to diversify the field. And so that's kind of been my lifelong dream. All right, I'm done talking.
That was great. Thank you so much, Dr. Gauze. And then last but not least, we have an orthopedic surgery resident, not an intern anymore. Almost done, actually, you're like halfway. We have Dr. Vince Morgan here from Rush University Medical Center. Welcome. Thank you so much for being here, Dr. Morgan. Sorry
Thanks
for
for
the
having
digression.
me. You're trying to demote me a couple years, please. I made it through a few. So yeah, I'm Vince Morgan from Chicago originally. I went to Pomona College out in Southern California for undergrad, then went to University of Chicago Pritzker School of Medicine for medical school. Now I'm in my third year of orthopedic surgery residency at Rush. I am looking to apply into sports medicine, so that'll be a fellowship after my 5th year of orthopedic training. As far as my motivation for orthopedics, and then I'll get onto like the mentorship aspect in a second. But for me, similar to what Dr. Oni was speaking on, the fact that in orthopedics, being able to see how patients can go from debilitated, immobilized, not able to do their daily activities of life, not able to walk with their significant other or play with their children. And seeing people post-op, 6 weeks, 3 months, a year out from these procedures, and just seeing how much that quality of life changes was something that was amazing for me to see as a medical student, and really seeing just the contrast, or just like how stark it was walking into one room where there was someone that really was in need of a hip replacement because they had bone on bone arthritis for 5 to 10 years. And then you see that patient, you sign them up for surgery, move to the next room, and you have somebody that's waltzing in trying to hug the doctor because they just gave them back, years of their life that they didn't think they'd have. So that's something that really drew me to orthopedics. As far as the mentorship aspect, I don't think anyone here will say that they got to where they were without mentors. For me, thankfully being at University of Chicago, I was able to meet a fair amount of Black men in medicine. Not too many that were in orthopedic surgery. In fact, there weren't any ortho faculty that were Black or looked like me at U of C. And that's kind of the nature of academic medicine, I think, across the board. Luckily, we have a few academic attendings here to represent. But the connections that I made with my non-ortho mentors at Chicago were able to connect me with Black orthopedic surgeons elsewhere, which was really pivotal for my journey. Probably the most pivotal for me was Dr. Gregory Primus, who was actually the first Black resident to graduate from University of Chicago's orthopedic surgery program. And he's a practicing sports med physician in Chicago. And so he kind of took me under his wing and kind of led me through my last few years of medical school before making my way over to Rush, and continues to be a mentor for me.
Excellent. Thank you everyone for being here tonight. We have a great span of a great group of people, both residents and faculty, so you'll get a large range of advice from all of these individuals. I would like to start off. So first of all, please, everyone, please put your questions in the comments and in the chats, and we'll definitely get to those. I see one there right now, but please don't be afraid to ask questions here. I wanted to start with what is your favorite thing about the field of neurosurgery or orthopedic surgery? And we can start, I can just call everyone now, I guess. We can start with Dr. Akinduro.
So my favorite thing about neurosurgery, I don't want to be too long-winded with this because I can go on and on, but I would say probably my favorite thing is the ability to pretty quickly, I won't say always instantly, except in strokes, to very quickly change someone's quality of life and quite often save someone's life in emergency situations. So like I said, my interest is primarily in complex spine and spine oncology, spine tumors. So like, for example, I was on call this past weekend. There was a patient, a woman who had breast cancer that spread to her spine, and now was compressing, an area of her spine, and she wasn't able to walk. We did that surgery on Sunday where, decompressed, fused, did all of that. And I saw her this morning, and she is moving her legs a lot more than she was, and now able to walk using a walker. And I mean, I'm sure she'll continue to progress. So it's just amazing to see that. And as chief, we have our own clinic where I see patients before, sign them up for surgery, and then see them afterwards. So, I mean, it's just been amazing to see how quickly you can significantly alter and improve someone's quality of life. So I think that's probably the main thing for me.
Excellent. Dr. Himanaka?
Yeah, I think along the same lines, I would second everything that Dr. Akinduro just said. But one of the things that I think my program director was actually the person who said this when I first started, that the worst day of somebody's life is when they're coming in to see a neurosurgeon. So I've actually really gained an appreciation for recognizing that that's the mental headspace and the condition of patients when they're coming in to see us usually. And I really enjoy connecting with patients through that sort of difficult part of their life. I found I've had, especially more recently, a lot of underrepresented patients have made comment about the fact that seeing someone who looks like them in our position and who's able and willing to take the time to explain things that other people may not be willing to or would assume that they wouldn't understand has been, I think, one of the most rewarding pieces of feedback or experiences that I've had recently. That's, I think, probably what I enjoy most about neurosurgery.
Dr. Sarpong?
And the surgeries.
Yeah, so I would say for me personally, I agree with my seniors with everything that they've said so far. I would say, the brain controls a lot of things that we do, and basically, controls the essence of who we are. So, pathologies of the brain mostly robs us of who we are, like the essence of who we are. So being able to have the opportunity to, either surgically treat those, I think were very, very important to me. And I'm always thinking about my brother's situation and stuff. If, there was some sort of intervention, probably he would have been able to walk. So those are things that drew me to neurosurgery. And I agree with Dr. Himanaka. When I started, I just started 2 months ago, and I've been in the ICU and just interacting with patients that come to Vanderbilt. And just them seeing me being Black at Vanderbilt, being the only Black neurosurgery resident in the department, and then just seeing me and just interacting with them, explaining the situation and how we're going to treat the patient and how we're going to manage the patient in the ICU. I think just seeing that spark in their eyes, it really confirms to me why I chose the field that I chose. And I'm very, very happy, to be here and just, answer questions also.
Great. And then Dr. Morgan?
Yeah, I think, one of my favorite things about orthopedics, and I kind of alluded to it a little bit earlier, is just the fact that, in ortho, we have the benefit of being able to really see something that's broken, like physically broken, like on an x-ray. You can see, anybody can look at an x-ray of a broken femur and say, that doesn't look right. And the amazing thing is being able to have an intervention in which you can fix this, and someone can literally be able to walk on that the same day. The idea of being able to take something that doesn't work and to fix it, and for someone to be able to have that mobility back is something that really really interests me and really keeps me going. Just being able to see patients kind of post-op after their procedures, and it's from fractures to arthritis, like Dr. Oni was speaking, to other more complex presentations. Just the ability to really see a problem and to fix it. And I think that's what makes a lot of us want to go into surgery in its own, just that ability to really have an impact that you can see and use your hands to create.
And then Dr. Gauze.
Yeah, I don't mean to commandeer things, but I'm happy to start answering questions for people, because my story.
Great, perfect. Okay, if there's nothing new to add, I'm happy to do that. Okay, great. So we will go ahead and jump in. There's already been a great number of questions. And the first one is, did you initially have queasiness when first exposed to surgery? And then how did you get over it, if so? And not everyone has to answer. I like Dr. Gauz's approach.
No, I'll go with this one right now. So actually, on my first surgery, I passed out. So I mean, I own it. It is what it is.
Own that. You better own that. Yes.
I didn't eat that morning. I was an undergrad.
Don't give excuses. You just passed out.
No, I have to give the excuses, So, but I was an undergrad. I was a volunteer at a hospital. I told the general surgery person that I wanted to shadow them. They're like, yeah, come on into the OR. I went into the OR that first morning. It was 6 a.m. in the morning or 7 a.m. or something like that. They tell me to scrub in. I'm like, scrub in? They're like, yeah. You just follow the scrub nurse. So I'm trying to follow whatever. I scrub in. I'm shaking in my boots. Like, wait, I'm in an operating room right now. And then it was a vulvar surgery, a belly surgery. They literally make an incision, and a balloon explodes out of the belly. And it's smelling like a combination of poop and burgers. And I'm just like, I just don't know what's happening to me. So all of a sudden I start feeling lightheaded. I tell them I needed to step away from the table. I didn't make it to the door. I passed out. Anyways, the next day I show up again after everybody started making fun of me. And I mean, it was pretty funny because, they needed to wake me up a little bit, pour some water on me that first day. But I kept showing up every day. And eventually I got used to the smell of bovies and, the electrocautery. And now the operating room is my happy place. So don't worry if you're a little queasy initially. You could get over it if you're passionate about it. So.
Great.
In the interest of time, you should probably go to the next.
Yeah, next one.
Yep.
Perfect. This one's a little specific, which is great, but does anyone have any advice on getting on a path into neuroprosthetics? And then I think there was like a little addendum to this in terms of it seeming pretty specific to neurosurgery, but like any comments on this?
Yeah, I was seeing this question in the chat, and actually, so despite the fact that I have done both an MD and a PhD, I'm actually doing a master's in bioengineering concurrently with my neurosurgery residency during my research year. And I had similar interests that drew me to do that initially. I can tell you it's not as far off as you may think. People are actually doing it in a non-clinical setting, at least at the moment. And I think the sort of hotbeds for that are places like Stanford, University of Pittsburgh. And then if you're interested in looking sort of more government related, there's a lot of like NIH and Department of Defense work that's going on in that domain. So that's where I would kind of start to look for opportunities to get involved with like a lab. I think the best way to sort of get your hands in in that work and sort of start making your mark, if you will, is to excuse me, to reach out to people that are working on it actively and see if you can be involved in any of their ongoing projects. If you have time during medical school, I'm not sure if this is an MD PhD student or like if you have like a gap year, then doing a gap year with a master's in bioengineering would be a great way to sort of get a foothold there. If you're doing a PhD, focusing your PhD on bioengineering would be a great way to get there. But yeah, I think you're correct that neurosurgery is a great way to do it. Other ways that you can consider if you're not sold on neurosurgery or plastics, they do a lot of neuro reinnervation work as well. Yeah, I think that's as much as I can say there, and that's where I would start. Yeah, if you have additional questions, feel free to like email or contact me on IG.
I guess the main thing, I don't know if people hear me. I'm kind of, my video is not great. Can you guys hear me?
Yes.
So brain machine interface is what I would Google. And then specifically with robotic limbs, Dr. Luthart is a neurosurgeon at Washington University, St. Louis that just had an FDA approval for a brain machine interface that attaches to a robotic arm for someone after a stroke. So something you might be interested in looking at. That's been FDA approved.
Awesome. Moving into this next one, what makes a good mentee, and then what ways would you recommend networking with URMs in your desired specialty?
Dr. Gauze is perfect for this one.
Yeah, I'm all over it. I was just, I don't want to jump in. So my brief thoughts. What makes a good mentee? Be aggressively, be humble. I mean, sometimes I know I remember being in your shoes 30, 40 years ago when I was a medical student. Now I'm just playing. And I was thinking about, okay, what's the best way for me to approach this person or that person? Just get out there. You got to put yourself out there, get uncomfortable, but also have enough common sense that when you are reaching out to someone, that you're respectful, that you remain humble. We know that you're smart. I know when I take on medical students and other types of students and residents, I know you're smart. That's how you got there. And you don't have to try and prove that to me. That part's been proven. You've proven that to other people. When you come, just be willing to learn, be ready to learn, be ready to be molded, essentially, because you're still dumb. I mean, you don't know anything. And you think you know stuff, you don't know anything yet. And so you're coming to us to get that information. We're gladly going to give it to you. And just be willing to grind, honestly. In this field, we unfortunately have to work 3-4 times as hard as our cohorts. And know that when you pick up a mentor, when a mentor picks you up, if they're asking you to do things or suggesting things to you, then it's because they've jumped through those hurdles and they have some insight on what it's going to take for you to be able to get to the next level. And if you expect that mentor to provide letters and make phone calls for you, you got to prove yourself. You got to show that you're willing to put in the work. And that's, I have several mentees, but they ain't all equal. And I'll be honest with you, and I give advice in the beginning and I'll let you do what you want with it because you're all smart. But that's been my kind of general advice. Am I answering the question? Let me read it again.
Yeah, no, that's perfect. And then with recommending networking, what would you recommend for that?
For your RMs? Well, this is one way, obviously, through SNMA. The pool is so small. The circles collide so often. I see Julius all the time in all sorts of things now. And there's different WhatsApp groups out there and just there's ways to get connected with that. I know this person in particular attends my daughter's medical school. So I can get you connected with whomever you want, Takara. So, I mean, it's the field, both fields, medicine in general is so small that the network is really easy to tap into. Just be willing to do it. I know that right now, particularly in medical school, it's hard to, you don't have any free time, you think. Just wait till you get to residency. You don't have any free time in medical school. So just take the time to reach out. And there's us. There's us that are out there that want to help you. And we're more than willing to. Obviously, our time is limited as well, but there are plenty of us to help you.
And if I could just put a plug in for the Gladden Society, we have a multicultural society for orthopedics. I'm actually the mentor and chair for the society, and Dr. Nathan Gauze is my co-chair. Yeah, so we are very interested and always looking to mentor medical students, undergrad students, who are interested in orthopedics, I'm sure there is probably a neurosurgery equivalent. And this is essentially like the society within the American Association of Orthopedic Surgeons that caters to people from underrepresented backgrounds. So I'm sure Dr. Akindor and the rest of the crew can probably comment on that for neurosurgery. But that's another avenue where you could try to seek out mentors and networking and see what's happening.
Yeah, I guess I would like to touch upon that a little bit. So neurosurgery, there's a Black Neurosurgeon Society. There's also women in neurosurgery. So I do feel not something we really touched upon. I do think there's some different hurdles for women opposed to men entering surgical fields. That could be a whole nother seminar. So you might fit into different groups and might find different ways to get mentorship. And the other thing I would say about being a good mentee is not to take things personally, be very flexible. It is a personality thing. Sometimes you don't find a mentor right away that meshes and works for you, and move on to someone else, find someone else, because there's not always a match. The first person you contact may not be the best mentor for you. So you have to be flexible enough to realize that and maybe seek other things, other opportunities.
So I know we got a lot to get to. I just want to quickly put the plug in for neurosurgery. The newest, the most well-known society right now is ASBN. So that's American Society of Black Neurosurgeons. It's fairly new, started during the pandemic time, but just Google ASBN or American Society of Black Neurosurgeons. We're trying to do a lot more, in the future. We have some seminars that we've had in the past and plan to have more in the future. So keep your ears tuned.
Awesome. Thank you all.
I think somebody was asking for the Orthopedic Society again. It's the Gladden Society. J.R. Robert Gladden Society. So.
And I think we'll also add some of this to the comments as well for you all. We're trying to curate this information. But please, if you missed something, let us know. Moving on to the next question. I think the next couple of streams are all about applications, which I think are great. Next question. Oh, sorry. We're going to put it up. The next question is, how do you think, or what do you feel will be emphasized in future residency applications? How do we best pursue those items?
So I think neurosurgery is going to be changing just like everyone else in regards to the fact that the step 1 score is no longer going to be graded. That's a huge thing. In talking about this with actually an orthopedic surgeon at my institution, Dr. Montgomery, he's interested in DEI and orthopedics. So we have a lot of conversations about that. And on one side, we were like, this is great. This allows for maybe some people who are marginalized to get more interviews, because now the weight of the step 1 isn't as heavy because it doesn't exist. But he countered that with me by saying, well, maybe now people from state medical schools or from HBCUs will be discriminated against. I thought that was a very interesting take. I don't know how it will be handled, but I will say that's the biggest thing coming, that we don't know how it's going to affect applications. Orthopedics and neurosurgery are among the top specialties with the highest unmatched people. And if you look at the trends, high board scores, the number of research publications, all these things are going up. It's a rat race that you may feel you can't win, to be perfectly honest. I think that we're learning how to navigate this, and hopefully we can provide you guys with information. But I do think fundamentally to matching successfully is getting to know institutions on a personal level, and so they can vouch for you, and the letters and your personal interactions. If you can get strong letters, that will trump a lot of other things. And if someone can make phone calls for you, that will trump some of these other things. If you don't come from a big splashy medical school, if you didn't do tons of research, but if someone can vouch for you who's pretty well known in the field and say, this person's a hard worker and they're going to go all the way, that carries a lot of weight. So I think I would probably focus on that now that there's some unknowns being thrown into the mix.
Yeah, Dr. Rodriguez is like spot on. And the only thing I would just add is try to make sure that you don't have blank spaces in your application. Like, you just want to make sure that you kind of have all the boxes checked off. You don't want to completely, if you're trying to apply to a competitive specialty, you don't want to completely have zero experiences in research and zero publications, zero, So you want to at least make sure that one, and with regards to research, if you're going to do research, make sure you're disseminating the research also. Most of those applications have publication/presentation. So when I'm reviewing your application pretty quickly, typically if you've had 3 publications, but you've published them in 15 places, it looks like you have 18 publications. And I when I'm reviewing that application real quickly, I just check off the research box, give you the full points for research. And that's usually what happens for most people. So keep that in mind, check all the boxes, make sure you establish some really strong relationships with people who are going to really sponsor you, who are really going to go to bat for you when it comes to the letters. Step 1 is obviously out of the question at this point, but that just means step 2 is going to mean that much more. Let's be frank about it. So if you not taking step 2 before the application, you're going to probably not be considered as strongly as someone who was taking step 2 and got the scores. Obviously, 3rd-year grades are probably going to matter more too. So make sure you honor, medicine, honor surgery, honor as many, electives or rotations as you can in 3rd year and 4th year. So that would be my advice. And obviously keep talking to your mentors and trying to see what the most recent trends are in your respective specialties, so that you could be the most competitive person you can be for those specialties.
Great. Thank you all so much for those answers. And then moving to a question about non-US IMGs interested in neurosurgery and orthopedics. What advice would you have for those individuals?
Yeah, I'll chime in real quick. So we have a lot of IMGs in our department in terms of research fellows. So I interact with them a lot, and actually our intern that we just took, he's an IMG, but I mean, this guy's excellent, like hard worker, like, go to bat for him. And he was at our program for, a couple of years doing research beforehand. So everyone got to know him. So my recommendation would be to find a program, even whenever you're planning to do like research, find a program you think you may be a good fit in, because honestly, that's going to be your best bet, because those are the people that you can get to know very well. They can get to know you. One thing I saw a lot of the IMGs have issues with is overcommitting very early and then underperforming. So learn yourself, realize what you can and can't do and what your limitations are, because the issue is if you're spread between 5 different attendings trying to do different things and you piss off one of them because you're not getting it to them, that's one person who's going to say, oh, this guy's terrible. This person's terrible. Just, we're not going to take him. That's all it takes is one veto, honestly. Unfortunately, that's the sad part about, any of these specialties is all it takes is one person who's like, man, no, we're not doing that. And then you're pretty much X'd out of the game. So be careful with that. That's one of the things I noticed a lot of people did. And that was probably one of the big reasons why those particular people didn't match. So yeah, just find somewhere to go to, work hard, grind, do as much research as you can, be productive, and then, don't make any enemies.
It's easy. And you made it sound super easy.
I know, right?
Awesome. Okay, I think we might go a little over on time, but some of our panelists might have to leave. We'll try to get to as many questions as possible. The next question that we saw was someone was asking about, sorry, I'm pulling it up. Is it common to have neurosurgeons and ortho spine surgeons in the same practice? I think this gets to like, what are the overlaps that you see with some of these specialties? And then like kind of how do you go about deciding which one you actually want to pursue?
Yeah, I'll answer that. For me, at my institution, and I think at many, even where I did training, neurosurgery and ortho split spine call. So there are definitely neurosurgeons and ortho attendings that cover spine call. And then in regards to training, I think there's a lot of overlap. However, I would say when it comes to pediatric scoliosis, the orthopods take the cake. If you want to be a pediatric scoliosis spine surgeon, you can do it from neurosurgery, but I would say it's highly unusual.
Ditto.
Yeah,
Great.
I wouldn't know anything about it.
Okay, perfect.
I was going to say there's a lot of variation because that's true at most places or a lot of places, ortho and neurosurgery split. But for example, at our institution, neurosurgery does all the spine. And there was like an agreement set in store, many years back. But yeah, just to second that, I agree. There's a lot of overlap. I will say during neurosurgery, you do probably do more spine throughout the breadth of it. Not at all programs. That varies from program to program. Like, for example, some of the residents I met at UF where we do our trauma, they only did 6 months of spine, but I know a lot of programs that do a lot more. So it's going to vary versus neurosurgery. We pretty much do spine from, day one to the end of it. So there's variation, but you can definitely do spine, going either route.
Great. And then next I wanted to go to Michael's question asking about families and balancing surgery and family time. I know this is a big question that always gets asked, I feel like, to this group of people. What are your comments on that?
I mean, I do have a family. I have a wife and 2 kids, 2 daughters under 2. Actually, today's my oldest daughter's 2nd year birthday. So, and so yeah, it's always challenging. Whenever you have a pretty demanding practice and you have to balance that with family. I'm not sure if I have great advice there, except that your number one priority should definitely be family, for sure. Because if the family, if the family aspect of your life is not well, you're not going to be able to provide the best care to your patients. At least for me, that is true. So for me, number one priority is family. I try to make sure that I'm constantly in communication with my spouse to make sure that I am showing up and being the best version of myself. But to be honest, I still could do better for the most part because I love work a lot. And I also do some entrepreneurship work outside of orthopedics. And between those 3 full-time jobs, being an orthopedic surgeon, the business and trying to be the best family man I can, it's extremely challenging and it's a constant, struggle. But what I've found to work for me is just like I schedule time to operate, I schedule time to spend time with my wife. I schedule time to spend time with the kids. We have a date night every week, and it sounds a little cliche, but sometimes if you just think you're going to do it, it's never going to happen. So I just schedule it in, and I still could do a better job, but it's a I'm a work in progress. Yeah.
I hope y'all recorded that because he touched on the basis of why there's so much burnout. He touched on exactly self-care is so important, and that includes your family because they're the ones that are supporting you. I'm not going to repeat what you said because you said it brilliantly, but that's why I switched jobs right there. I switched jobs because that was more important to me than making a ton of money.
I would say that the ACGME is becoming more cognizant that this is an issue. So one of the senior residents told me that they're allowing more time off for residents for personal reasons, for personal leave. That used to not be the case. So for example, a lot of women residents, if you took off pregnancy leave and you didn't have all your clinical rotations quite done, you didn't graduate in July. It's something they don't tell you about until you become a resident. And there are some women residents that were finishing clinical months past their graduation date because they took off a certain amount of time for pregnancy leave. And you have to have a certain amount of weeks that count towards clinical time to meet requirements. And in neurosurgery, it's flexible because you do have research time, but sometimes obviously you can't plan a pregnancy or plan the physical aspect of pregnancy. I think is not something that we really talk about. And that can be really difficult if you don't have a good pregnancy, if God forbid you have a difficult pregnancy. And so now they give you more time. I heard that's like 2 to 3 months or something. It's much more accommodating. So for personal leave time and residency, and that's brand new. I think that is going to help a lot of people.
Thank you. That was really great. Next, talking about research, what's the best advice you have for medical students interested in neurosurgery or even orthopedic surgery to expand their research, but they don't have maybe a home institution to do that at?
Yeah, I mean, I could chime in because I, dealt with that exact situation. Didn't have a home program. Morehouse School of Medicine. Absolutely loved my medical school. But yeah, we didn't have a neurosurgery department. So I did benefit from the fact that there was a neurosurgery department within the city. I will say I've spoken to people that don't even have that option. So for me, I mean, essentially, like I said, I just sent out emails. I mean, you don't want to be bothersome. You want to say everything in a very respectful manner. And of course, the first draft email I sent out, I always had, someone within my, institution just take a look at it. Like, hey, is this, you think I should say this? Just make sure, that your first foot is your best foot. And you just want to make sure how you come across is, respectful. And once they do potentially open the door for you, I mean, you need to just hit the ground running. So my recommendation is just, search people, find out who's doing things that you may be interested in, reach out to them, and just, you just got to keep on knocking until the door opens, honestly. I ran into a lot of closed doors, early on. Dr. Oyosiku was who first kind of responded and opened the door, but there were a lot of closed doors before that. So you just got to keep on trying.
And I will say from a mentor point of view, I've had people reach out to me that were in various states and asking me for research projects. And I will say that I'm busy, so I don't always answer all my messages and emails. So the ones that are more tenacious, I had one young woman from Puerto Rico who she messaged me like 2 or 3 times, and she emailed me, and then I was like, okay, she has what it takes to be a neurosurgeon. And it wasn't annoying. It was just she asserted herself and knew I was busy and was like, I'm not letting this go. You said you were open to it, and like, let me know what I can do. And so, I mean, we just submitted a paper and she's on it. So
I would second all of that, and then also add to it that at an institution that does have neuroscience, you can also kind of get your foot in the door research-wise, doing some things at your home institution that are more basic science related, but that have relevance to neurosurgery. And if you can get really high impact publications out of those experiences, then I think it's just as sort of appealing to institutions as having multiple clinical papers.
Great.
One thing I did want to add to that, and it's just kind of related to orthopedic surgery, neurosurgery as well. If you have the opportunity, I know it's not always the most ideal, but a lot of students do take a year off in between their 3rd year and 4th year of medical school to do research at another institution. For Rush, for instance, we have probably 15 or so medical students that are kind of transitioning between 3rd year and 4th year because they didn't have strong research departments at their institutions, and they are for sure building up their applications, and they're going to have more research than pretty much anybody that went straight through, just because of the nature of that year. it's a sacrifice, but if you're someone that needs to build up your resume in other ways, it could be worth it.
Great. And then moving to Tiff's question, how would you recommend going about selecting schools that are DO friendly? And then how should we go about applying to MD residencies?
Tiffany, I think, Julius, you know this young lady as well, this little rock star. So I'll answer real quick. From what I'm ascertaining, particularly at UMKC as well as at the University of Missouri, it's all fair game. I don't know that there's any significant discrimination, if you will. I'll use that word judiciously, discrimination between DO and MD. I would encourage you to apply to both, obviously. Signaling, since everybody on the panel familiar with signaling? Yeah, I would assume you are. I just learned it. That's why I'm asking the question. I know my weak spot. So signaling basically means I have a certain amount of tokens. I think ortho might get 20. I'm not sure what neurosurgery gets. When you apply, you send a little, it's like giving a little rose, right? You want to go on a date, you give a little rose, and you say, hey, here's my 20. I'm going to send it to these specific programs because I'm really interested in you. The other ones I'm just applying to, you guys, I really like you. So here's my signal. You know, I think you need to be, because this is the first year, very strategic about how you send out your signals. But I don't think you need to be worried about whether it's a primarily MD or DO program, because I think, in my opinion, all bets are off. We're not looking at that. We're looking at qualified applicants, looking at diversifying, at least I am, looking at diversifying the field, getting people that we're going to interview that are actually going to add to the program, not just be another checkbox. Good question, because I think it's been pretty, having a daughter at a DO school, I'm learning all these things, so I'm still figuring it out.
Yeah, I think a vast majority of the younger cohort of surgeons starting to like not necessarily make a distinction between DO and medical MD programs, but I would still say that there's still a little bit of some residual discrimination there, particularly with some of the old school guys and gals. So I would say that still exists. I certainly, when I think about the different measures of diversity, that's actually one of the things that I look at. Like, you know, your experience being from a DO school versus a allopathic school, I think it brings, because I'm also the diversity chair for Hopkins, and so that's one of the things we look at, that, you know what, you bring a different set of experience that could hopefully, you know, enrich and improve the quality of the mix that we have. So don't worry about it. Apply far and wide to all the MD schools you want to apply to, and just develop some personal relationships also as much as you can there, particularly in the places you want to go to, and that goes a long way. So.
Yeah, I'll probably just add by just saying, you know, apply widely, but also do your research and look at programs and see how receptive they are to, you know, if like none of their residents are DO, you know, that is a program that you might value networking with and attending at that program so that you can get a leg up. So those are things that I would just add on. Just do your research, you know, research more programs.
Absolutely.
Excellent. And that was actually our last question, but just to close out, could everyone on the panel say a one-word / one-liner of wisdom to the audience? So starting with Dr. Akinduro.
One word is tough. I don't know that many one words, but a quick one-liner, something that someone told me is you're never, let me see, on your worst day, you're never as bad as you think you are. On your best day, you're never as good as you think you are. Keep that, you know, think about that. It may take a little while to process that, but basically, you know, in your bad days, there's a lot of bad days in neurosurgery and orthopedics. You're not as bad as you really think you are, you know, and then on your best day, kind of stay humble, because it's easy to ride that success and try to just be, you know, riding success to success. And it's not always going to work that way. So that's all I got.
Dr. Himanaka?
That is really tough. What came to mind is a line that my dad used to always say to me, which was, speak softly and carry a big stick. And I didn't fully understand the wisdom behind that until residency. And I think the message is very similar to what Dr. Akinduro just said, like, be humble, stay humble, always be thinking about ways that you can be improving yourself silently. Everybody doesn't need to know what's going on in your head or what your process is. And your big stick is all of the things that you're doing to be a better neurosurgeon, orthopedic surgeon, or whatever field you decide to go into.
Dr. Sarpong?
Again, I agree with my seniors, what they said. I would say along the same lines, most of these programs are all looking for people who are teachable and coachable. So, when you're applying to these programs and you're interviewing, this is something that should be the highlight of your trait or your characteristics that you show, that you are coachable, you are teachable, you are willing to learn. And always, I'll add that just seek mentorship early, reach out to people. There are always people willing to help.
Great. Dr. Morgan?
So I would say biggest advice is if you can just learn one thing every day, say, you wake up, I'm going to learn about ankle fractures. I'm going to learn one thing each day. That will help you build a foundation of knowledge, and you'll look back and you'll be surprised at how much you learned. But if you just tackle one thing daily, you'll be surprised at how much you can overcome.
Dr. Gauze?
Wow. So we're clearly at different spaces in our stages in our life. So my quote would be, you can't be what you can't see. And so you see us all here, the importance of mentorship, the importance of giving back. We've got some bright and talented people listening in. You're going to make it. You're going to do great. You're going to be very successful. You got to give back. You got to do things like this. You got to give of your time because the next generation needs to see you. And so be visible. Don't go in the shadows like I did for 9 years in the middle of Iowa. You have to continue to support and give back. All right, that's all I got.
Dr. Oni?
Yeah, mine is the quote that says the journey of 1,000 miles starts with the first step. It's easy to see all the people on the panel right now and think, man, you guys have made it. This is going to be such a long road to get there, but you already took the first step joining this webinar. You're already taking the first steps, trying to figure out how to become a neurosurgeon, how to become an orthopedic surgeon. Don't get overwhelmed by it. Figure out what the different parts are to get in there and just take that one step. Reach out to that one mentor or prospective mentor of yours. Reach out to folks that are in the medical school class before you that I've been successful. Reach out to other people that graduated recently that have been successful. Those people are your best resources. So just take that one step today. Don't let the complexity of getting there paralyze you.
Great. And then Dr. Rodriguez.
Sure. So one thing that I tell people is don't listen to the haters, because we talked a lot about mentorship and other things, but I will say personally, it's a hard road, and there's some people who are not going to be your biggest cheerleader. There are a lot of anti-cheerleaders on this path. You have to remember who you are. And anytime I get really doubtful or I start questioning my path in life, my mom always tells me, you're on a lease. And this is what you were meant to do. And I know that sounds weird, but I give myself little pep talks all the time. I definitely think remember who you are, remember your purpose, your destiny. Don't listen to all the negative haters and the negative energy. Put that to the side, because you need to remember who you are to get through this path. It's a hard path. It's not easy.
Thank you all so much. And thank you to all of our panelists. We appreciate your support of the SNMA and our membership. And I encourage all of you to follow us on Instagram at SNMA_official or on Twitter at SNMA, and then like us on Facebook. This will be posted, so you can go back and look at everything again if you need to get those words of wisdom, or just listen to the last 5 minutes of just words of advice daily or something like that. I probably do. Most importantly, if you're not a national member, please visit snma.org to sign up and get connected. There'll be more events like this from both orthopedic surgery and neurosurgery. thanks for tuning in. And then also, I look forward to seeing you all at upcoming Sowing Seeds webinars, which are posted. We have one for radiology, derm, neurology, combined residencies, and urology coming up. So please stay tuned, and thank you all again.